I see you're wearing a mask to prevent infectious disease and epidemics. Well, I think that's very socially responsible of you. Good for you. No, the Ebola virus hasn't crossed the Atlantic yet. Let's hope it never does. Hi, I'm Joe Alton, MD, also known as Dr. Bones, the disaster doctor of doomandbloom.net, where you'll find over 500 posts on medical preparedness for any disaster. I'm also the co-author, along with my lovely wife, Amy, a nurse practitioner, of the #1 Amazon bestseller in survival skills and safety first aid, The Survival Medicine Handbook, and also the designer of the upcoming board game, Doom and Bloom Survival, a great way to get the whole family thinking about survival issues. Now, this is America's favorite yakkadoodle, TD Bird, and this guy, of course, needs no introduction. Several countries in West Africa are in the throes of an epidemic of Ebola virus. Over 1,200 cases and almost 700 deaths in the countries of Sierra Leone, Guinea, and Liberia make it a candidate for the next great pandemic. The disease has decimated healthcare workers, with the number of doctors, nurses, missionaries, and others dying from the disease. Now, despite this, few people really know what Ebola virus is and how it does its damage. They certainly don't know what to do if it arrives in their neighborhood. Ebola virus, a member of the filoviridae virus family, was first reported in 1976, where 602 cases in the Democratic Republic of the Congo resulted in 431 deaths. Ebola, named after the river where the first victims were identified, has several variants, a sign that it probably has the capacity to mutate. What do we know? Not much. How Ebola manages to first infect humans is poorly understood. Primates like monkeys and apes are possible agents of transmission, also called vectors, although birds, rodents, bats, pigs, and insects may be more likely to transmit the disease. The virus can even be transmitted to dogs, although they don't seem to get sick from it, the illness. Ebola appears to be transmitted through saliva and other bodily fluids, even sweat. The practice of relatives and workers washing a body before burial may have helped spread the disease. A 2012 Canadian study suggested that the virus may also be transmitted in air droplets. Now, given the highly contagious nature of the illness, this would be big trouble if true, but it hasn't been proven yet. What does Ebola virus do to its victims? Ebola causes a hemorrhagic fever with a 25 to 90% death rate, much higher than even the worst of the influenza pandemics of the past century. Compare this to a 2.5% death rate from the Great Spanish Flu epidemic, that was in 1918, and 0.1% from a routine influenza outbreak that we see today. Now, symptoms begin presenting about 2 weeks after exposure. Ebola patients developed a sudden onset of what first appears to be influenza. Aches and pains, cough, sore throat, shortness of breath, fever and chills, general ill feeling, these are commonly seen at this stage. Nausea is noted, often accompanied by abdominal pain, diarrhea, and vomiting. Later on, the central nervous system becomes affected. Headaches, altered mental status, seizures. These sometimes even result in the patient going into a coma. Evidence of disorders in blood clotting are seen as the advanced stage of the disease. Signs include spotty rashes, bruises, broken blood vessels in the skin, collections of blood under the skin after injections, bloody vomit or sputum, spontaneous nosebleeds, bleeding from gums, blood and bowel movements. Now, once bleeding disorders occur, the likelihood of survival is pretty slim. Although deaths from severe hemorrhage have occurred in women giving birth that have Ebola, multiple organ failure leading to shock is the usual cause of death. Now, as the illness progresses, body fluids from diarrhea, vomiting, and bleeding become very contagious. Poor hygiene and lack of proper medical supplies in underdeveloped countries, such as in West Africa, impede the progress of medical authorities to tame this outbreak. Now, the best they can do is isolate sick individuals as best they can and follow infectious disease precautions. Now, this is something they're apparently not doing so well because so many medical personnel are getting sick. When the doctors and nurses are dying, you know you have an illness about which to be truly concerned. Imagine if the disease becomes worldwide. So how do we cure Ebola? We don't. There is no known treatment, cure, or vaccine for Ebola at present. The doctors can only try to make the patient comfortable and hope that they get better on their own. Therefore, I recommend stocking up on masks, gloves, eye protection, and gowns, overalls, coveralls, things like that, even hazmat suits, and learn about how to have an effective survival sick room. We've got a video on our YouTube channel on the subject, as a matter of fact. So why should you care? What's the big deal? Why should an epidemic in Africa matter to citizens of countries thousands of miles away? Well, this outbreak is not in the deepest areas of Africa. It's on the west coast, a more populated and easily traveled area. News about the virus is disrupting the economies of the countries involved, and their governments haven't been all that straightforward about giving reports until just recently. So we don't really know what's really happening. The country of Guinea, where the first cases occurred, is the world's largest exporter of bauxite, the ore used to make aluminum. Therefore, exports from the country go to many of the world's manufacturing plants. The advent of air travel can certainly and easily spread the virus throughout the entire world in just 24 hours. As a matter of fact, a Liberian official took sick on a flight to Nigeria, one of the most populous countries in Africa, and died soon afterwards. With an incubation period of a couple of weeks, you might have Ebola and not even know it until you've infected a lot of other people. This may be a third world disease now, but it wouldn't take much to make it indeed the next great pandemic. We'll keep you posted. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching. Hey, are you ready to deal with medical issues if times get tough? Check out our book, DVDs, survival board game, and our entire line of medical kits at store.doomandbloom.net. With our help, you can succeed even if everything else fails.